Hello, we are looking at speech in this video. Speech are of two types, okay? You can have spoken speech or written speech, right? So, spoken speech is something like you are hearing somebody talk and you want to respond by speaking, fine? Written speech is something like in the exam. You read the question and you write the answer, okay? So, first let us look at spoken speech, what and all areas of the brain help. Written speech, what and all areas of the brain help. Okay, we will look at each of these separately. First of all, let us look at spoken speech. Your friend is talking to you, you want to respond. Okay, so for that you're going to go to spoken speech areas of the brain. First of all, here you can see 2021. These are the audio psychic areas. So the audio psychic areas are going to understand the audio, right? You're going to hear the audio, like what your friend is talking, you can hear. Then come to vernix area. Vernix area is the sensory speech area. Vernix area is actually 40 and 22. Okay, between 40 and 22 you have the vernix area. This is the superior temporal gyrus, right? And here you have the vernix area. This is going to understand what your friend is saying. Your friend is saying something and you're very interested because you're understanding what the friend is saying. And now you want to respond. When you want to respond, you're going to use the motor area. Motor speech area. This is motor speech area of Broca, Broca's area. So here what is going to happen, this is in the inferior frontal gyrus. As you can see, it is in the inferior frontal gyrus. It is area 44 and 45. Fine. Area and 44 and 45 are going to plan. Yeah, I'm going to say something. My lips and tongue have to move like this. And now you want to execute the plan, which is the motor area, primary motor area in your brain. Here, right, 4, and that is going to plan the movement of your lip and tongue, and you're going to speak to your friend very happily. Fine. So how did we come? Audio psychic area, vernix area, sensory speech, motor speech, Broca's area, and then you have the primary motor area, which is going to move your lip and tongue. Fine. That is your spoken speech. Audio psychic, vernix area, motor speech area of Broca, then you have the motor cortex helping you to move your parts of the body, lip, tongue, etc. This is a very high level, like we are telling you. There are a lot of details you can check. Now coming to written speech, this is exam. You have to read the question and write the answer. Okay. So to read the question, what and all you have to do? First of all, you have to have the visual ability, right? So visual ability comes because of the visual area, 17, 18, 19 in the occipital lobe. 17 is the primary visual, 18, 19 are the visual association areas. These will now see the question. Discerner area is going to be the sensory for the written speech. It is going to understand the question. Discerner is 39, remember that, broadband area, 39 in the brain. So discerner is going to understand the question. Now wait, I know the answer. So if I know the answer, what should I do? Go to motor speech area, Broca. Broca's area is common, as you see here. Broca's area is going to plan. How do I move my hand and my fingers, right? Broadband area 44, 45, that's Broca's area. That is going to tell primary motor area 4, and that is going to plan the movement of the finger and the hand. But here there is one extra area, Exner's area. Exner's area in coordination with the motor area will make your hand and finger move. Fine? Fingers move. Fine? So did you understand the written speech? Shall I explain written speech again to you? Visual area, look at the question. Discerner area, you're going to understand the question, read it. So basically you're going to read and understand it. Then you have the motor speech area of Broca, 44, 45 broadband areas. These are going to plan the movement of the finger in the hand. Tell the plan to motor cortex, 4, area 4. And then you have the Exner's area, which in coordination with the motor area is going to bring about the movement of the finger and the hand. Fine. So this is a very high level understanding of speech. Okay, if somebody asks you a question on speech or Broca's area, please write this. Okay.